Coming to arteriosclerosis. Arteriosclerosis, it is a general term that we use for thickening and hardening of the arterial walls that lead to various health problems depending upon the specific type and location of the affected arteries. So, what are the types of arteriosclerosis? It can be senile, hypertensive, or Monkberg. The senile arteriosclerosis, it is mainly caused due to aging. So that refers to the thickening of the arterial walls due to increase in the collagen and elastic tissue. So as we age, so these tissue they accumulate in the walls of arteries. So that would make them stiff. So the stiffness of arterial walls that lead to elevated systolic blood pressure in the older individuals that make them more prone to hypertension and its complications. The second type is hypertensive arteriosclerosis. It is caused due to the high blood pressure or chronic hypertension. So here there is deposition of hyaline in the walls of arterioles that thickens and weakens the vessel wall. It can be hyaline arteriosclerosis or hyperplastic arteriosclerosis. Hyperplastic, there is proliferation of smooth muscles in the walls of the arterioles that gives the onion skin appearance. The third is the Monkberg arteriosclerosis, that involves the calcification of the tunica media, the middle layer of the arterial walls. So here is the question, what is the primary pathological feature of the Monkberg arteriosclerosis? The answer is median calcific sclerosis. So it is characterized by calcification of the middle layer of the arteries that is visible on X-ray. So what are the features of atherosclerosis? Atherosclerosis is the most common type. The primary arteries they are affected are the aorta, coronary arteries and the cerebral arteries. So there is formation of atheromatous plaque. There is accumulation of lipid-laden cells, cholesterol and other cellular debris in the intimal layer of the arterial walls. So that lead to inflammation and can lead to formation of thrombi that can obstruct the blood flow. So atherosclerosis, it primarily affects the large and medium sized arteries and can lead to various clinical syndromes that are depending upon the location of the plaque. The various clinical syndrome they can be related with heart. There could be chest pain, myocardial infarction that occurs due to the reduced blood flow to the heart muscles, and it occurs when plaque ruptures and there is formation of blood clot. So that will block the coronary artery and it can lead to chronic ischemic heart disease. On the brain, it can lead to temporary reduction in the blood flow to the brain that causes a temporary ischemic attack. There could be stroke, permanent damage to the brain tissue due to the prolonged ischemia. In the peripheral vascular disease, it affects the limbs, causing pain, mobility, and sometimes leading to ulcers. There could be aneurysmal dialysis. The weakened arterial walls can lead to aneurysm. And there could be mesenteric arterial occlusion. Now let us discuss the causes. The first, the reason being the aging, hypertension, high cholesterol, smoking, diabetes, inflammation. So they will cause reduced blood flow, ischemia, increased blood pressure, organ damage, heart attack, stroke, peripheral vascular diseases, or the aneurysm. Now, moving to the risk factors. The risk factors could be, the major risk factors are the dyslipidemia. So abnormal level of lipids in the blood, such as high LDL, that is known as a bad cholesterol, and low HDL, that is known as good cholesterol. Other could be hypertension, like high blood pressure, which can damage arteries over time. Diabetes mellitus, high blood sugar levels contribute to arterial damage. Smoking. Other could be the risk, it increases with the age. They are more risks than the women. The woman risk increases after the menopause due to the lower estrogen level. Family history of atherosclerosis or related condition that increases the risk. Family history of related conditions like diabetic, hypertension, they also affect. Other are the emerging factors. They include the environmental factors like higher incidence in developed countries due to lifestyle and dietary factors. Obesity, being overweight, it increases the risk. Hormones like estrogen deficiency. The postmenopausal women, they are at higher risk. Oral contraceptive used by women are at higher risk. Lack of exercise, stressful life, homocystinuria, alcohol, elevated levels of factors that promote the blood clotting, such as fibrinogen, increases the risk. Infections may contribute to inflammation and atherosclerosis. High CRP, elevated CRP may contribute with the higher risk of atherosclerosis. So the major factors are the dyslipidemia. So what if dyslipidemia? It refers to the abnormal level of lipids in the blood that increases or elevates the level of cholesterol, triglycerides, or the both. Now cholesterol, we know it's a waxy substance that is found in blood and cells. High level of cholesterol, especially the low density lipid, they contribute to the plaque buildup, and it is known as bad cholesterol. Triglycerides, these are the type of fat, they are found in the blood. Elevated triglycerides can also contribute to atherosclerosis and the heart disease. So remember, the LDL cholesterol is known as bad cholesterol. It can deposit cholesterol in the walls of arteries, forming plaque. So these plaque can grow over time, and they can narrow the or block the arteries, then can lead to heart attack or the stroke. HDL is known as good cholesterol. It helps to remove the LDL cholesterol from the bloodstream. So higher level of HDL, they are associated with the lower risk of heart disease. Very low density lipoprotein, remember, that is VLDL, they are associated with increased cardiovascular risk when compared by high triglyceride level. Now what could be the cause of dyslipidemia? Family hypercholesteremia and other genetic disorder can lead to elevated level of cholesterol from the birth. Consuming a diet that is rich in saturated fats, trans fats, and cholesterol, they can raise the LDL cholesterol level. Diets such as rich in fruit, vegetable, whole grains, and healthy fats They can also help lower the LDL cholesterol and triglyceride level. Lifestyle factors could be lack of physical activities like smoking, alcohol consumption, and obesity all can contribute to dyslipidemia. Medical conditions like diabetes mellitus, hypothyroidism, and chronic kidney disease can alter the lipid metabolism and increase the risk of lipidemia. Now, how can you manage the dyslipidemia? Remember lowering the LDL level, raising the HDL level. So managing the triglycerides, lifestyle modification like weight loss, reducing alcohol intake, limiting simple carbohydrates can help to lower the triglyceride levels. Apart from that, you can take is omega-3 fatty acids or fibrates that can lower the risk of atherosclerosis. Other is hypertension. Hypertension means there is elevated blood pressure. So that can increase blood pressure, exert mechanical stress on the arterial walls, on the endothelial lining, that can damage the endothelial and cause endothelial dysfunction. So that may impair the endothelial ability to regulate vascular tone and permeability. So the hypertension, it doubles the risk of all the cardiovascular diseases, including coronary artery disease, strokes, and peripheral artery disease. Next is smoking. Smokers, they have higher risk and more severe form of atherosclerosis compared to the non-smokers. It decreases HDL, cholesterol. Smoking alters the coagulation system, promoting the thrombus formation. Inhalation of this carbon monoxide from smoking leads to formation of carboxyhemoglobin that will reduce the oxygen delivering capacity, and hence that will favor hypoxia, and hence it will cause atherosclerosis. Other is diabetes mellitus. We know diabetes mellitus, it is an autoimmune destruction of the insulin producing beta cells in the pancreas. So patient with the type 1 diabetes, they are prone to accelerated atherosclerosis due to chronic hyperglycemia. Diabetes again can cause endothelial dysfunction. It can alter the lipid profile, accelerate atherosclerosis. Other factors are age, sex, that we have already been discussed. Now let us discuss about pathogenesis of atherosclerosis. So according to the original response to injury theory, that was stated that it was considered that there was endothelial injury that lead to smooth muscle proliferation. In the early lesions. The modified response to the injury hypothesis implicated that the lipoprotein it enter into the intima layer as initial event followed by lipid accumulation in the macrophages. That is the modified theory. So the atherosclerosis, it starts with the damage to the endothelium, the lining of the blood vessel. So this damage can be caused by factors like high blood pressure, chronic high cholesterol level. So that triggers a cascade of events rather than just physical damage leading to inflammation. So here is the question: what is the initial event in the pathogenesis of atherosclerosis according to modified response to injury? So it was the atherosclerosis. It begins with the endothelial injury. So after the endothelial injury, so you will see the smooth muscle from the artery wall migrates to the damaged area. They multiply and produce the proteins like collagen and elastin that forms a fibrous cap over the growing plaque. The monocytes, blood monocytes, they are attracted to this damaged endothelium. So they enter the arterial wall and engulf the oxidized LDL cholesterol and transform into these foam cells. So these foam cells, remember, these are the hallmark of the early atherosclerotic plaque. So the chronic level of LDL cholesterol, that is the bad cholesterol, and low level of HDL cholesterol, that is the good cholesterol, they contribute to the endothelial damage and foam cell production. So as the plaque grows, it can rupture, leading to blood clot formation, that is the thrombi. And thrombi, it can further block the blood valves and can cause heart attack or the strokes. Other is the monoclonal theory. It suggests that the monoclonal hypothesis state that the atherosclerosis, it begins with the proliferation of smooth muscle cells in the arterial walls, similarly to how the cells they proliferate in the cancerous growth. So proliferation of smooth muscle cells in the atherosclerosis may be triggered by a mutation caused by chemicals like those found in cigarette smoking and certain viruses. Now, what are the morphological features of the atherosclerosis? Let us discuss that. First of all, there would be fatty, streak and dots on the inner cells of the inner lining of the arteries, that is the lining of the intima. You will see small yellowish lesions, so that appear in the early in the life, and they are composed of foam cells. They have elongated smooth muscle, lymphoid tissue and small amount of lipid, collagen and proteoglycan. So here is the question, what is the role of foam cells in development of atherosclerosis? So the answer is B. So foam cells, they are macrophages that have engulfed oxidized LDL cholesterol particles in the arterial intima. So they try, so these are the foam cells. So they try to remove the excess cholesterol and lipid debris from the arterial wall. So when this process it becomes excessive or inefficient, foam cells they can contribute to formation of fatty streaks and atherosclerotic plaque. The second stage is a gelatinous lesions that develop early in the life and may precede atheromatous plaque. So the third stage is atheromatous plaque that is formed. A fully developed atherosclerotic lesion that is known as fibrous plaque. So fibrous cap, remember, it consists of smooth muscles, dense connective tissue, proteoglycan and collagen, and the core, it contains lipid, The core contain lipid, cholesterol cleft, necrotic debris and the foam cells. The next stage is formation of complicated plaque, and the advancement there is in the aortas and coronaries arteries. There may be calcification, ulceration, hemorrhage and aneurysm formation. So these are the major site of atherosclerosis in the descending order of frequency. Remember that for your exam point of view.